everybody. Welcome to Nashville's Hospitalogy pop-up event. My name is Abby Lemon-Stevens, joined by my co-host,
Katie Smith-Green.
And we are joined today by Ascension St. Thomas Women's VP for Women's Services, Kimberly Wells. We're excited to talk to you today, Kimberly, just about 2026, some wild healthcare predictions, and what's going on for you. So welcome, Kimberly. Thank you.
Thank you for having me.
Absolutely. First, tell us a little bit about you, your role at St. Thomas, and what you're getting into this year.
Yes, I am so fortunate to be the Vice President for Ascension St. Thomas for all things women's services. Many that are here in Nashville know us as the baby hospital. We deliver the most babies in Middle Tennessee. I always say if you line up a kindergarten class, 1 in 3 were likely born at St. Thomas across the system. And so that's a huge honor to serve the community in that way. But I've been really fortunate to be in this role the last 2 years to push the envelope on innovation. We know women are more than I like to say our uteruses. And while the miracle of a baby is incredible, we have so many more needs than that. And so it's really been a fun journey to break that apart and say, how else can we serve and what else can we do?
That's awesome. What is your background? What perspective are you bringing to this conversation today?
Yes, I've been a little bit of everywhere, but primarily my perspective, I'm a hospital operator at core. So I've been in hospital admin, hospital CO, and CEO here in Nashville for a number of years. So super exciting, though, to come bring that exposure from being inside the hospital, being a patient myself in the women's service line, and add that strategy and innovation lens to it.
That's awesome.
That's amazing. We're so glad to have you today. Before we get into some of the heart of our conversation on what's going on in 2026, we can talk about AI and technology. I'd like to hear a little bit about how you're pushing that envelope. I know you have an upcoming event. Tell us a little bit, Her Health 360, right? So Tell us a little bit about that and how we might get plugged in.
Yeah. So this was a dream we had last year on a $0 budget and a 3-person committee. We kicked off Her Health 360 last year and had over 400 women attend our spin. Yes.
Cool.
Thank you.
That's amazing.
A free event for women, and it's a spin on a women's health fair. So all the things that you likely avoid in your healthcare journey, either due to time, anxiety, financials, we want to put it all in one room with bring your girlfriends, bring your mom, have a glass of wine, listen to some country music. And we also had an educational panel called What Your Mama Didn't Tell You, and wanted to help break down some of that intergenerational educational gaps that play a huge part in a women's journey. And it was wildly successful. We had to kick women out, unfortunately, and said, happy for you to do this, but you can't stay here. And by the time we left, we were already planning for year 2. So we have officially launched that for May 7th, 2026. It's Thursday night before Mother's Day weekend, and it will be at the Musicians Hall of Fame.
Amazing.
Nice.
And we'll be increasing our attendance. Our goal this year is over 600 women. And again, to have education, fun, music, shopping, but also you get to shop your providers. So we have every specialist that St. Thomas offers, from pelvic health to metabolic health to cardiology, GYN, and you can schedule real time. You could also get your mammo on site.
No
So
way.
I was going to ask on-site screening.
You can on-site screening. We're going to have EKG screening this year. So just another way to arm and engage with the community where they're at. Partner with TEDx Nashville. It's a huge support of ours. They will be there again this year. We have a couple other surprises in our back pocket for the event, but super excited to launch it again for year 2.
Gosh, that's amazing. And just thinking about, I'm mom to 2 kids, like I'm also making their healthcare decisions. So if I could have access to all of these people in the same place, that's going to be awesome.
Check it off the to-do list.
Yeah, absolutely. Okay. May 7th, Musicians Hall of Fame.
Yeah.
I'm going to be there. Katie, you're going to go?
Unfortunately, I will be out of town that week.
You can send a friend.
Sounds awesome, though. I'm curious what you see from a community impact standpoint. Talk to me about like the vision of this event, because I feel like there are so many important needs that you just rattled off that this outreach is really touching on.
Yes. So we know women make 80% of the consumer decisions for a household. We also know that in the world, we are 51% of the population, which I always say that does not make us a niche population. We are the majority.
We're not a specialty.
We are not a specialty. We are not just small, tiny men is another phrase we tend to use. And so let's create a forum where we're at the forefront. We are the majority. It's a comfortable but informal, authentic space for women to not only connect with one another, but to connect with the clinicians, to ask the questions that you might be too afraid to ask in the exam room, you didn't know to ask, You don't take the time because it conflicts with all the other responsibilities you have. So
you're scared to ask.
You're scared to ask. You don't have time to ask. You don't have the financial resources to ask. And so all of the reasons that we said, this is going to be a free event. We're going to bring it and partner with the right leaders and partners here in Nashville to alleviate that. It really also started out of a dream where we said our new campaign, if you've seen it around Nashville, is care for every woman at every stage of life. Again, knowing that legacy and inheriting what a wonderful legacy of being the baby hospital. But women's health is complex. We are complex beings and we need to own that as women. And as a health system, we need to be there to support that. What you shouldn't have to manage is it being complicated. So we as Ascension St. Thomas under the Women's Services, how can we make it less complicated? And this one event was really a combination of, okay, let's take out all these steps. If it's just one day a year, we can take out those pieces for you and embrace your complexity, but make it less complicated.
So you're bringing the clinicians to the event.
Absolutely. In the white coat.
It's an open house.
It's an open house. You can shop your primary care. You can talk to the GYN who might be doing your pap smear. Last year, we had the equipment that you have your pap smear. Most of the time, we're on the other end of the table. You don't even get to touch and feel that. We had a robot that could take out your uterus for a hysterectomy in the building on site. So when
a glass of wine really helps ease that conversation.
Absolutely. And so again, arming you with information that you otherwise don't have the time or not a space. And we said to our providers, we want you to wear a white coat. We want you to break that myth. We want it to be a comfortable space. Instead of seeing somebody in a white coat increase your blood pressure, we want to decrease the blood pressure.
What was the feedback you heard from the clinician staff after this event?
They loved it. We are so fortunate at Ascension St. Thomas that they really embody that truly authentic connection. And we had wonderful stories of women who avoided care for a number of years. Mostly anxiety was at a root of several, and they could go right up to the table. And I looked over as a particular woman who early 30s had dealt with fibroids for a long time, wasn't sure what to do with it, was worried about the outcomes of some of those long-term decisions. And she went over to tell the story and the provider just paused and you just saw them put their arm around her shoulder. And anything else in that moment didn't matter. She may not even signed up for the appointment, but she had a moment for somebody to listen. And our providers loved that opportunity when they're also busy during the day. And it was a moment for them to take a pause and do what they really love, which is educate and connect with patients.
Awesome. Connecting as people in a totally different environment makes a really big difference.
Absolutely.
Yeah.
Okay, we have a hot take that you are going to respond to. We gave people some of Blake's predictions for the year that he published at Hospitalogy. And I think the one that you were going to respond to is about the AI orchestration layer is here as use cases converge. So as we really start to move from point solutions to AI orchestration being much more detailed, complex, involved, and reaching much farther across use cases and sites and populations and everything. So what about this prediction landed for you and how does it jive with what you're seeing in your world?
Yeah, I think this prediction's going to explode in 2026. And we already see it in pockets and many of our consumers and patients. You probably don't realize that ambient AI or agentic AI is already in your exam room with your providers. And fortunate to be a part of Ascension St. Thomas, our president, Eduardo, came out just in the last couple of weeks talking about this global modernization that is occurring and we are going to be a part of as Ascension. So to be with a company in the health system that's not just shying away from it, but embracing it is very exciting to watch the two worlds merge. I think the space I'm most excited from a VP level and looking at the strategies and the partnerships is how it will extend some of our physicians, prevent the burnout. They're human too. And how we can use these tools to be more efficient, still high quality clinical programs that they're all used to, but help them be more efficient and have more time for human connection. I think that's what everyone's craving. And we already are seeing some of that, and it's probably just not as forward-facing to consumers. The other thing I'm really excited to find some innovative partners and a part of our Health 360 as well. We're doing an innovation startup pitch. And so who's out there doing virtual doulas? Who's out there doing that postpartum complex remote management when as a postpartum mom of 6 weeks and you have a newborn baby and you're having hypertension, the last thing you want to do is get yourself and the baby back out of the house to go in for that check. And so how do we leverage that to make your healthcare journey that much easier? I joke that I have 3 kids as well, and there's a lot of focus on the 4th trimester from a postpartum depression and mental health. How can ambient AI be another tool there to reach and complex needs, but reach you where you are. St. Thomas has a 45 county stretch. We obviously cannot be in all counties at all time in person. And so how can we use some of those tools for that?
Yeah.
That's awesome.
Amazing. Oh, yeah. Kimberly, we're so glad to have you here. I know I can tell you I'm a third generation deliverer. My mom, myself, my daughter, 3 generations of babies born at St. Thomas. Really proud of what you guys are doing in the city and who you represent. Thank you for joining us today. We're excited for her Health 360 and all that you guys are navigating in 2026.
Yeah. Thank you so much for being with us.
Thank you.
Yeah.